On Sunday, 14th of January, the Nigeria Center for Disease Control was notified of 4 cases of Lassa fever among healthcare workers in Ebonyi State. 3 of the 4 cases have subsequently passed away. The Honorable Minister of Health, Isaac Adewole, immediately requested that the Nigeria Center for Disease Control provide support to the government of Ebonyi State to investigate and respond to this cluster of cases. Meanwhile, the Lassa fever outbreaks have spread to other parts of the state, including Kogi, Ondo, Imo, and Anambra states. On Core Health today, we will examine the reasons behind these outbreaks, preventive measures, as well as treatment options. Hello and welcome. I am Ibironke Airelovegbe. Lassa fever is a viral hemorrhagic disease caused by contact with food or household items contaminated with rodents' urine or feces. The Lassa virus may also be spread between humans through direct contact with blood, urine, feces, or other bodily secretions of a person infected with Lassa fever. Nigerians in Lagos State are, however, calling on the government to take waste management and environmental sanitation more serious in order to tackle the Lassa fever outbreak. Listen to this.
I think, in my own opinion, I think our environment are not yet safe. Because if you look at Lagos, for example, there are some remote areas where attention has not been given to as regards refuse cleaning. As I'm talking to you now, if you get to my area in Ikorodu, we have refuse that have lasted for over a month. They've lasted for over a month, and still we've not gotten any waste management officials to come and clear those refuse. And if you look at it, all these things are the things that attract rats, that causes all these things. So if the government cannot address the issue of environmental cleaning very well, so we'll continue to have that issues. Then secondly, government should be able to do sensitization. Our environment, our gutters, at least periodically, maybe once in a year, at least, so that, like in the house I stay, my landlord took his time to do fumigation, so you can't get to my compound and see rats. So I think government can do that campaign, or make sure they enforce house owners to do fumigation. All estates should do fumigation. I think that will go a long way in curbing the Lassa fever.
Yeah, I think the ministry should go to the rural places, find ways of how to tackle the issue from the grassroots. What is the real cause of it, so that it will be off once and for all, because I think it is spreading wide now. Places like Ondo State, for a case study, I think the government of that state should look for a way of tackling that issue for now, because it would spread to other places. Lagos, for instance, is full of people. Once you get to Lagos, I think it's going to be worse than any other place. So I'm appealing to the Federal Ministry of Health to look into that issue and tackle it once and for all.
Here in Nigeria, about 2 or 3 years ago, or thereabout, and we are informed by the medical corps that they actually discovered a solution to this. Although I think there was 1 or 2 victims then, those who touched this thing. So I think the issue of Lassa fever is not strange to Nigeria. The medical field, the medical people should be able to advance in terms of achieving results in respect of this matter.
All right, so when you say advance, what exactly are you talking about? Is it in the treatment?
That's yes, they will make more research. They make more research on how to improve on the extent they have gone previously. That's what I mean by advancement. If they are relaxed in the past, they need to gear up a research aimed at finding lasting solution. It is not matter of each time this type of thing crops up, a known ill health or sickness, a known one, then they start running helter-skelter. It means it becomes a makeshift.
Although there is no vaccine currently available for Lassa fever, the disease can be prevented. Members of the public are advised to keep their environments clean in order to discourage rats from entering homes. Foodstuffs should be stored in rodent-proof containers. Garbage should be disposed properly and far from the home. And hand washing should be practiced frequently. Before we bring you more on this, we'll go on a short break. Stay tuned.
If you are not idle, nobody will probably come and encourage you to join their gang or the group.
Yes. To keep Nigeria one is a must that must be done. Nigeria is not going to break.
So if I don't buy this one now, how much you go sell this one?
I will fee give you 500.
Sure? This one?
Yes.
This small banana?
Yes.
I know that Buhari can do it.
He has a lot of plans. We should be praying for him. He's a human being. Anything can happen to anybody. The majority of the law they pass belong to them, to favor them, not the masses in Nigeria. If we want to change, let's change generally. Don't let's change half. Let's change generally.
The people giving voice to the voiceless.
Welcome back. Now we will be talking with a public health educator, Samuel Okeride, on what you need to know about this deadly disease.
When we talk about Lassa fever, we are looking at what we call an acute hemorrhagic fever. Okay, by hemorrhagic we mean it's a viral infection that causes bleeding generally. Okay, that causes bleeding. Now, so what causes Lassa fever? Lassa fever is caused by a virus called Lassa virus, which is transmitted by an infected multi-mammoth rat. Now, you may want to wonder what, when we say multi-mammoth rat, these are a specialized form of rat that give birth to plenty children. When you differentiate between the normal rat, house rats, and the multi-mammoth, when you turn it, you see that there's so many breasts, because of the number of children that they have. And Lassa fever has been with us. As a matter of fact, the name Lassa was gotten from Nigeria, a state in Borno called Lassa Town. I think in 1969, so where we had 2 missionary nuns that died from the same. So it's really been a thing that's been with us for that long.
All right, okay. As a public health educator, what are the signs, the symptoms one should watch out for to really say this person has been infected with Lassa fever?
Okay, so before we talk about the signs, I think the first thing we need to know is how is it transmitted. Okay, because if not everybody, if you go all through Nigeria now, in West Africa, there are rats everywhere. So how is Lassa fever transmitted? Usually it is transmitted when you have the feces or the urine of infected multi-mammoth rats that we talked about. Now, so when you have them urinate or defecate on the food substance, usually, or even on surfaces, you can have it. When you ingest those food substances that are contaminated by such infected rat, then the person can come up with it. Also, it's very possible that maybe by inhalation, that means by breathing those particles, the rat defecates somewhere, it becomes dry, and then the air, moves that stuff, and the person inhales it. The person can also contact lots of people, and then the one that you talked about, and the cases we've seen, especially among the healthcare professionals, you can also have it when you have usually unprotected contact, when the doctor doesn't take the necessary safety procedure, or the nurses or the care, they could come up with Lassa fever. Then going on answering your question as regarding the signs and symptoms. Okay, the truth of the matter is not everybody that get contact with that stuff that you really get to see symptoms. The symptoms will take between, some say between 6, some say between 2 to 21 days, so 2 to 3 weeks before you start seeing those symptoms, what we call the incubation period. So what are those symptoms? I say these symptoms are non-specific. They are the symptoms you will see in every other, maybe malaria, headache, fever, weakness, malaise. Generally, these are the earlier stage. Then before we now have the late stage, where we now talked about the hemorrhaging, where we now see blood coming out from the eyes, from the orifices, the nose, there's bleeding into the skin, and then as a result, shock coming, and then later part, death. The first thing we need to know is that preventive measure is that we need to, number one, create awareness. We say what you know is what, you understand, kills you. If you don't know what's killing you, so people need to know that Lassa fever is endemic in West Africa. It's endemic, it's plenty in Nigeria. Now we've had multiple cases in Plateau State, in Taraba, So how do you prevent the spread? Number one, as much as possible, there are people who eat rat. I know you know that, I hope you know that. People who eat those rodents. When I was in Plateau State, some people were eating it. And so one, you want to discourage eating of those rodents as much as possible. Rats, they say it's bush meat or something. Those rats, you want to avoid it. Number two, you want to talk about the mode of transmission, like we said earlier on, is that you have the urine and the feces on food surfaces. Recently, like we discussed earlier on, the Anambra State government banned Gary. Now, why Gary? It's simple because people, for example, spread their food item outside. Their Gary, their cassava, their fish, and they say they want it to be very dry. Now, while they are on the ground, you have rodents coming, and then all those rodents come and they defecate and urinate on it. Now, for the Gary especially, people just pick up the Gary, and then the next thing they're already swallowing. So, as much as possible, you want to avoid opening food that you're going to eat directly in the sun, or where you can have those rodents come defecate on it. That's one. So two, for those who store food in the kitchen, okay, in the kitchen, you want to put them in what we call rodent-proof containers. You want to make sure they are well closed. Okay, when you cook your food, for example, some people just open, they say they want it to be cold. As much as possible, you want to keep your food substance also very, very close. Now, there's something that usually attracts rodents. Not forgetting that, and that's what we call dirty environment hygiene. Now, when you have environment that are very dirty, improperly unkempt environment, those things could actually attract those rats. So, as much as possible in preventing Lassa fever, we want to ensure that our environment is very clean. Now, I want to particularly appeal, especially Lagos. If you go around Lagos now, you find out that there are so many refuges and everything. Those are things that actually attract rodents, some of those rodents, and can bring about the infection. Now, for the health workers, because we say they are also more prone to having the infection. When you want to care for, they need to, as much as possible, practice the universal safety precaution. You want to make sure you're well protected before you touch any patient. Once you have a case of high fever or somebody, a case that you're not sure of, as much as possible, you want to ensure that you're well protected. Okay, so basically these are the commonest ways in which we can prevent. You want to cover the food. Then some people have advocated use of what we call the biological way of attacking the rat. I mean, use of cats, you know, the Mickey Mouse, and once you have those cats, one way or the other, they can get to, you know, chase the rat and also kill some of those rodents, basically. So those are the common ways we can prevent the spread of Lassa fever. And most of them, like I said, awareness and sensitization, because a lot of people don't even know about it.
The onset of the disease, when it is symptomatic, is usually gradual, starting with fever and general weakness. To know more about this disease, kindly tune in after this break.
Over 2,000 communities in Nigeria, each with its unique story. Some reel of comfort, most with its complaints. Whatever the story is from your community, we tell it. Let's journey together through streets, homes, markets, every nook and cranny to tell your story the right and the true way. Community Focus. It's all about you and your community.
Humans usually become infected with Lassa fever from exposure to urine or feces of infected rats. Lassa virus may also be spread between humans through direct contact with the blood, urine, feces, or other bodily secretions of a person infected with Lassa fever. Let's hear more from Dr. Samuel Okerindi.
Can you talk about awareness and sensitization? And we all know that Lassa fever is not new to Nigeria. But the question is, why do we keep having outbreaks? Because it's like there are times, there are particular period of time these outbreaks usually come. And despite government interventions, creating public awareness and sensitization, why do we keep having reoccurrence of
Okay, we would continue to have the outbreaks or the epidemics when we don't take care of our environment. Okay, when our environment are not well catered for, where we have refuse being everywhere, where we have people not taking in like the preventive measure. Then two, Africans sometimes you tell someone something and say this thing is not good, don't do this, and before you know they tell you you're just saying your own. I remember then in Plateau State when I was serving then, and there was an outbreak of Lassa fever in Plateau State. It's a real life story. I actually went to the village and I was telling some of them, this rat, you want to, and they called my bluff. They said, guy, we've been eating this rat for long, and so these are ignorance, and then sometimes people going by their own volition and defying all government instructions and every other thing is what has made Lassa fever, keep having the outbreak. Then also, secondly, is I think that the government can do more. Okay. If they have been creating awareness, I think they need to create more. They need to ensure that the environment is clean. They need to ensure that they do what they are supposed to do as regarding the environment. If they can do that, I'm sure the population of rodents, And another thing that's also caused some of these things is having a lot of deforestation recently. So you have rats moving from the natural habitat to the urban area, and which is causing increase on explosion.
Deforestation, that is a bush burning.
Yeah, it's bush burning. When by the time you start burning those bushes, the rats that are naturally there will just run out from those places to the urban area. So that's one of the reasons.
That's one of the preventive measures now we can.
As much as possible.
Alright, okay, let's look at treatments of this disease now. Why is it that we can't have, there are no specific treatment that can actually treat this disease? Why do we have to have doctors, patients dying because of Lassa fever outbreak? Are there no vaccines, no drugs, no treatment that can actually solve this problem, just like the way we were able to tackle Ebola and outbreaks?
Okay, I think statistics shows that over 100 to 300,000 people get infected with Lassa fever every year. Now, out of that 100 to 300,000, only about 5,000 deaths is recorded. Now, so 80% of those who get infected with Lassa fever might not even become severe. You just have something that looks like mild malaria, mild fever, and they're okay. They're okay. They don't. But from the remaining 20%, you have those who now have severe complications. Some of them now have deafness and all those things, and then out of that, about 1% now dies, and then go. Now, going to your question, there is actually no vaccine for Lassa fever. Okay, because if there was, everybody would have also gotten vaccinated. And going back to answering some of your questions, which is the treatment, because the symptoms are not specific. So somebody comes with fever, comes up with malaise, feeling of weakness, come up with tiredness. Oh, you have malaria. Go and treat yourself. And so before you know it, the presentation is usually late. But if people could present early enough their drugs, because it's an antiviral drug called ribavirin, so they can be placed on treatment, and then of course other form of they will recover. Okay, now that's one. Also, before you can say somebody have Lassa fever, there have to be a test. And the interesting thing is that there are only few centers, probably 1, 2, 3 centers in Nigeria. I think Irua is the commonest one. So they have to take the sample, they have to take it to that place, they have to confirm what this person actually have or not. So diagnosing is another thing, presentation is another thing. But if a person is suspected, especially from the history, you ask the person, oh, I ate rat last week, or I ate rat, or 2, I traveled to a place where maybe the places that we've had cases, Kogi, Plateau, or places where then you want to, if possible, without waiting for the results, you want to start the person on ribavirin. The person, when started early, have a higher chance of surviving. So death due to lack of early diagnosis and treatment.
Okay, so what's your advice now to the government, or what do you think the government can do to urgently address this issue, especially in terms of the treatment, diagnosis, and
Okay, as a primary health, I want to say number one, there's a need for government to take the environment serious. There's a need for government to enforce that people, regulations that make people to take care of the environment. Okay, that's one. What can they do? Simple, they need to create more also awareness on Lassa fever. There are many ways they can do that. Churches, mosques, the kings, traditional settings, and rulers, and all those things. So more awareness. Then for testing and laboratory diagnosis, they need to create more centers. They need to have more specialists that will be in different, if possible, different geographical, geopolitical area where we have more specialists do the diagnosis and testing, and if possible, make the treatment free for everybody who come down with Lassa fever. And then lastly, which we always ignore, that especially for the healthcare professional, people like the doctors and nurses, there should be what we call healthcare life assurance for them. In cases we have people who lose their life to some of these things, they should be able to cater for them and their family.
Alright, okay, lastly before we go, what's your advice to the Nigerians out there?
Okay, so my advice to Nigeria is this. See, prevention is better than cure. For Lassa fever, the preventive measure we talked about, when you eat your food and you're not going to eat it again, it's that you discard and discard properly. So don't open the food, don't open your gari, don't cut your yam, and then you leave it, and then you come back later to come and eat it. So as much as possible, put those food, preserve them in a rodent-tight material, and then take care of the environment. It's very, very key. Use rodenticide, clean your environment. When you finish using your plate, the common one, make sure you wash it instant so that the rat doesn't have what to feed on, basically. So that's my advice to Nigeria. Take care of yourself and your environment. It's very key.
Lassa fever occurs in all age groups and both sexes. Persons at greatest risk are those living in rural areas where rodents are usually found, especially in communities with poor sanitation or crowded living conditions. However, it is advisable to take proper care of the environment and also protect food items from rodents. Remember, your health is more important than any other thing. This is how far we can go today till we come your way next week. Don't forget to send us a text for your contributions, comments and observations on the number displayed on your TV screen. I am Ibirunke Ira Lovigli. Bye for now.